What's up, y'all? This is Shannon, the Iron Nurse Practitioner, and I wanted to bring a subject that I've heard a lot about online, people asking lots of questions about it: anxiety and iron deficiency. You've either heard it or experienced it with your own iron deficiency. And in my years of hematology, I probably had thousands of people tell me that they had an anxiety disorder. It became so obviously linked to iron deficiency that I'd simply say, we'll see how you feel after iron. So I want to give you all the science behind the connection so that it may first alleviate your stress and concern about it, and second, help you identify this and connect it to iron deficiency for yourself or someone you know in the future. To understand iron's role in anxiety, we must first understand iron's functions. Iron is needed for hemoglobin production, which is a red blood cell, oxygen transport into cells, which is cellular respiration, immune function, neurotransmitter metabolism, and DNA synthesis. Without iron, cells cannot get enough oxygen in all of our systems, including the brain. Additionally, part of iron's neurotransmitter role in the brain is dopamine and serotonin regulation. Serotonin is a brain chemical or neurotransmitter responsible for your sense of well-being. Low serotonin levels are linked to depression, and many antidepressant medications have a serotonin regulating pathway as a means to control depression symptoms. Dopamine is a neurotransmitter linked to stress response and emotional regulation. Low levels of dopamine are highly suggestive of poor stress response with emotional dysregulation. Therefore, many studies implicate low dopamine levels as a cause for anxiety. Low iron levels leads to low levels of both neurotransmitters. Iron carries oxygen to every cell in the body, including the brain. Low iron leads to oxygen deprivation or hypoxia in all parts of the brain as well as the rest of the body. The prefrontal cortex, the area of the brain responsible for decision making, logical thinking, and emotional regulation, is particularly impacted by hypoxia and therefore is more likely to cause anxiety and mood disorders when oxygen deprived. Through complex pathways, iron deficiency is also linked to higher cortisol levels. Cortisol is the stress hormone that lowers your immune response. Not only does cortisol increase inflammation, weight gain, and infection, elevated cortisol can contribute to increased anxiety symptoms. With greater anxiety, cortisol levels increase, further elevating anxiety like the proverbial snowball effect. So, how can we manage anxiety? Breathing exercises. Increasing oxygen can lead to better prefrontal cortex functioning. I've always taught the 4-second technique, especially when experiencing heart palpitations or anxiety. This is 4 seconds of inhaling, 4 seconds of exhaling, 4 seconds of pausing, and you repeat until the symptoms pass. Vitamin D. Whether you get out in the sun 15 minutes per day or you're taking capsules, make sure your vitamin D levels are between 50 and 80 on your blood work. Low vitamin D has been implicated in neurologic dysfunction, anxiety, and depression. I have covered in previous videos that low vitamin D is also a risk factor for hypophosphatemia after IV iron infusions. Exercise. I know that if you're dealing with low iron, that exercise is hard to fathom. However, exercise can increase serotonin and dopamine levels, thereby reducing episodes of anxiety and or depression. Although there is no direct smoking gun cause and effect, some studies have shown that 35 minutes of exercise per day or 240 minutes per week report less anxiety than those who do not exercise. And finally, get iron. Whether orally or IV, get your iron stores to a normal range with a ferritin at about 100 and keep it there. I've shared in other videos that I've always recommended taking a multivitamin with iron even after getting your iron to normal levels because you need and use iron every day, and you need at least 8 milligrams of iron daily if you're not menstruating and 12 to 18 milligrams daily when you do menstruate. And with most of Americans not getting that in their diet, I always recommend a multivitamin with iron. So I hope that helps you understand anxiety and how it relates to iron deficiency. Please leave me any questions you have in the comments section. Please like this video and share it with anyone you think this will help. Thank you so much. This is Shannon, the Iron Nurse Practitioner.